everyone, my name is Dr. Ann Noabuebo. I'm a doctor of physical therapy and a board certified pelvic health specialist. So if you've heard a lot about the pelvic floor and you're not quite sure what it is, or even how you find your pelvic floor muscles, I'm here to share more about that. So first, the pelvic floor, what is it? The pelvic floor, I'm going to use my model here. The pelvic floor is an area of your body that takes up the space between your right hip on the right side, your left hip on the left side, your pubic bone in the front, and your sacrum and your tailbone and back and slightly on the bottom over here. Now, this is the pelvis for somebody that has a vulva. So inside the pelvic floor, we have organs, and that's the bladder, the uterus, the ovaries, and the rectum. For someone that has a penis, there would be a prostate in here. There wouldn't be a uterus. For the other structures can include connective tissue or fascia that wraps around all of these structures. There are certainly the muscles. All this red stuff represent the muscles of your pelvic floor. There are ones that are a little bit more on the outer aspect, and there are deep pelvic floor muscles inside as well. And there are blood vessels and there are nerves in your pelvic floor as well. There are 5 big functions of your pelvic floor muscles. Number 1, they help with sexual function. Number 2, they help with bowel and bladder control. Number 3, they help to support your pelvic organs like your bladder, your rectum, and your uterus. Number 4, they offer support and stability through your spine and your pelvis to make up part of your core muscles. And number 5, they help your lymphatic system to pump fluid back up towards your heart. All right, so let me talk you through how to find your pelvic floor muscles. The only piece of equipment that you'll need for this is a small hand towel. If you don't have a hand towel nearby, it could be a sweater or any other type of piece of clothing, like a scarf. If you have any of that, go ahead and just roll it up so it looks as close to this as much as possible. Place that on the seat that you're sitting on. Just make sure that it's not, for example, a couch where you're sitting pretty low down to the ground. Let it be a standard chair. And you're gonna look like this. So you're sitting right on top of it, essentially straddling the towel. Okay, so let me talk you through this before you actually do this. The most efficient way to connect with your pelvic floor muscles is with your breath. So I'm going to talk you through how you inhale and exhale and find these muscles. Please bear in mind, when I ask you to inhale, I'm asking you to inhale through your nose, and you're going to exhale through your mouth. Your lips are going to look like you're blowing out a birthday candle, like that, okay? So when you inhale, you should feel like your lower ribs come out towards the sides and your abdomen comes forward a little bit. As you do that, your pelvic floor muscles actually drop down towards that hand towel or piece of clothing. When you exhale through your lips, your ribs come back towards the middle, your abdomen flattens a little bit, and your pelvic floor muscles lift up towards the ceiling, okay? So let me talk you through everything. So go ahead and take a big breath in through your nose as your ribs expand out to the sides and your pelvic floor muscles drop down towards that towel. And exhale through pursed lips, your ribs pull back towards each other, your tummy flattens out, and your pelvic floor muscles gently lift up towards the ceiling, and go ahead and let everything go, okay? So those are your pelvic floor muscles. Now, only engage enough for the length of time of your exhale. I don't want you to go overboard with this. This is just to help find your pelvic floor muscles. I hope that was helpful. Thank you for watching, and I'll see you soon.